Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and we are wrapping up Heart Health Month. Today we have Marija and Jacob with us. It's Marija Zaruba and Jacob LaShot. They are both physical therapists with our TMC Outpatient Therapies. Welcome.
Thank you.
Hi, everyone.
We're going to be doing something today about moving makes the difference. They've got a great presentation to really show you all the research on why you need to be moving to make a difference in your heart health. So I'm going to go ahead. You may be watching us today on either our YouTube channel or on one of our Facebook pages. Please feel free to leave any comments, and afterwards I'll go ahead and ask any questions that come in. So I'll turn the floor over to you both. I think, Jake, you were going to start with the presentation, and I've gone ahead and put that up for you.
Great. Thanks, Maya. All right. So let's dive in here. This is Heart Health. We are physical therapists in our normal outpatient setting across the street from the main campus. We're here to tell you our take on things. Here's part of our team here, small part of our team. I want to say thank you to the previous lectures, because a lot of the previous content we would cover, they've done beautifully. And so we appreciate that. And then we'll spend a little more time on our unique role in a healthcare system and promoting movement related to heart health. Some barriers and limitations to exercise, what's normal and what contributes to disease. So this has been talked about a bunch in the previous lectures. So these are modifiable factors. They've been said a million times. We're going to spend a little bit on a couple of them, but mostly our take on the physical activity side of things. So this has been shown in front of you a few times as well. Just heart blood pressures, what's normal, what's high. Marija is actually going to go in a little bit more detail about this because of what's healthy and what's not, and safety and some other considerations. But this is a graph that shows what changes over the years as we age. The top is systolic, so basically the pressure against your vessels when your heart beats, and the bottom is the diastolic, the pressure when your heart is at rest or not beating. Anyway, it does show a graph from 18 to 80 and gradually rising as time goes up. And I'm going to refer back to this for some of the things that I'm going to talk about that, but remember what this looks like. So we are not cardiac rehab. We're the outpatient therapy across the street. But we do see people after an event. They probably will go seek cardiac rehab if they've had any of these things on the list. Anything that needs monitoring for their safety will be over at cardiac rehab. And some of the things that I described coming up, we will do, but most of it's cardiac rehab. So cardiac rehab and some of the things we do actually does incorporate all of these things. There will be some form of evaluation. There'll be a bunch of education. They'll monitor you while you exercise. There's a support system, and there'll be some appraisal of physical activity. So I'm going to go through each. So the support system, it's tough after you've had an event to know what to do. It's anxiety provoking to exercise after you've had some related event that affects your heart, and you're not really sure what you're capable of, what's normal, and they will help you through that. And they'll evaluate you to make sure you're healthy enough for exercise, what your physical abilities are, limitations. It's part of a team that kind of evaluates you and tries to figure out what's the next best step for you. Of course, all of this involves education, lifestyle changes, healthy diet, weight control, smoking. These are all things that'll be requiring some guidance after some sort of cardiac event or cardiovascular disease, whichever you're coming to see folks for. So physical activity during and after a program will be established. So what's it like at actual cardiac rehab or in our clinic? And then there'll be some follow-up what you're supposed to be doing afterwards. It's several days per week, often is 5 days per week. And you want to be able to match that with your time after the rehab program. So outcomes are clear. Cardiac rehab works. So they will do a mix of things there, though. They'll have you on a recumbent bike, a treadmill, rower, depends on your abilities, other limitations you might have. And they'll work with you to figure out what you need to do. But overall, it's kind of comprehensive. They need to check a lot of boxes for other health-related factors to make sure your outcomes for the exercise portion are what we need. There tends to be a lower rate of rehospitalization, heart-related illness, and deaths. There's quite a bit of satisfaction with the rehab programs. They pay off in the long run for all the lifestyle changes. So participation and compliance really matters a lot in the long run if one completes a full program and has lots of information and education for the afterwards. So the actual cardiac rehab, CRs, cardiac rehab, they are quite a long process after an event. Like I said, 5 days a week, quite a few sessions over a several month period. That's really typical. Your program may vary more than that. Any program for any patient, it may vary depending on what they're there for. But they're a long process, and it does establish guidelines for what you should be doing after that time. Home therapy can be similar things. So someone comes to your home and helps you out with some of those things and determines an exercise program that's fit for you. They can look a lot like that as well. All right, so we're also going to cover a few things. Timelines for cardiovascular fitness, like how long does it take? That can depend on what you want to do in life. Some people want to be able to walk a mile with their friends. Some people just want to be able to do simple things like take out the garbage without losing their breath. I'll tell you right off the get-go, it does take a few weeks to get in shape. You've noticed some changes about 3 weeks, but 6 weeks usually for a lot of changes to happen. We're going to get a little more detail about how fast it goes away. 2 weeks, sorry to say that's pretty quick, but that's what's going to happen. But a lot of this doesn't have to happen. And that fourth kind of point on there about what's normal for our genetics in this first world, what is normal for us to experience, how much fitness can we have and get and keep, and then what's it like to keep it. And that comes to the point of this next slide. So there's 2 lines on there. The darkest one at the bottom is the average population. And the top one is what they would call master athletes in this study. So you can see the line goes from 0 to looks like about 85 or so for the average population or average life expectancy for United States. And that top line is people that have exercised. And master athletes being more than the recommended minimum amount of exercise. And that center section right there, that shaded region, is basically a quality of life argument. So the average line there where people tend to come and see us, kind of about where that arrow drops down where it says increased lifespan. It's about when people come and find us. They retire, they have less reasons to move, they're doing less, they may be less exercise. And what happens is they get into a lot of age-related disability that is, we can argue, not very normal. So there is an average amount of exercise that's normal or minimum amount that we would want people to achieve. And there's more than that. And that's what the second line is. And remember this graph because there's going to be a couple of graphs that gets into what's normal and what's not. So lots to unpack here on this slide. So the top graph, it can be just like that last previous slide. So when you go to study other populations that don't have the same diet we have, the same sedentariness, like hunter-gatherer populations or third world populations, they tend to look like the top line in that last graph you just saw, where they look like the master athletes. They will have temporary illness, they will get sick, they will have problems, but the last chunk of their life isn't marked by disability. They're not having trouble getting around. They're not having trouble lifting the things they want to do, hurting themselves when they do certain things. But a lot of this does pertain to your overall heart health. And the second part is the overlay of our population with those. So there's basically this increased amount of time at the end of life that you spend more in disability. And why movement matters makes all the difference in how this goes. So how much you want to be able to do at the end of life, how capable you want to be, how much you want to lower your risk for cardiovascular events. And that all has to do with fitness and a couple other factors you'll see in some of the studies that we talk about. So that is the retirement and the decline of health discussion that I'll be talking about. And there's plenty of ways to get around that. And I want to tell you what's normal and what our perception of normal in this country is and what we can do about that. Senescence is something I'll describe in a couple slides coming up. But there's plenty of ways to stay active and decrease the amount of morbidity that you have in your life and how much risk towards cardiovascular events you have in your life. And active grandparenting theory is one of those. Just having a reason to move. If you have to take care of grandkids, chase them around, that's the reason to move. And you wouldn't believe what that does for inflammatory status in our body. So senescence is a biological process. It's a signaling process in our bodies to signal aging. It's complicated. There's lots of ways that happens. But when the body signals to age, all kinds of things decline. We lose muscle, flexibility, organ failure, all kinds of things start in the process, gray hairs, you name it. Example, these leaves, basically a tree, when it wants to lose its leaves, it's going to have a chemical process about it where it signals to itself to change in color over time so that it can drop its leaves and start all over again for the next season when there's more available daylight. Fruits do this too, but basically my example here is aging. There's a chemical and signaling process that happens with aging, and it's complicated in us. And I'll show you on a slide on why movement matters. My argument about the bananas is the almost. That's the perfect banana. The last one is a little too done for me, so I'll disagree with the slide a little bit. But this is senescence. So a lot of people think when they age, they lose muscle. Like that's the normal process. But in fact, there's a chemical signaling process that happens when you're losing muscles. Your muscles signal to you to age. And there's an inflammatory process that goes along with this. And I don't expect everyone to understand all of the big words and inflammatory mediators on this slide. The long and short of it is, it's a two-way street. Yes, you lose muscle because you're not using it or you're doing less in life. You're just not challenging them, so your body doesn't keep them. But you wouldn't believe what this does to your overall heart health as well, or overall health in general. The lack of muscle signals to your body to continue to age and more, advance in age. And this is why we try to promote this so heavy. So this is an MRI of two different people, and it's their thigh. So that middle, right in the middle there is the femur bone, your leg bone. And what you're seeing is muscle and a fat layer around that. The age 25 person, you can see that there's quite a robust muscle in there and a little bit of subcutaneous fat around the limb, and that's normal. We all have a little bit around us. But the 63-year-old that's right next door is a little bit more fat. A little bit more fat is integrated into the muscle. If you're going to the grocery store, this may look more like the marbled steak, more than the filet mignon on the age 25-year-old. But this does have part of that signaling process of increasing your aging. But it's also a functionality argument. This person's not as strong and not as able to do things like they want to do. But you have a huge hand in how that goes. So 3 different people, all their thigh bones are visible there. The top person's a 40-year-old triathlete and the bottom person's a 70-year-old triathlete. So they basically are in the same level of fitness. That would say the bottom person being that master athlete person on that top end of the slide. This is a lot more exercise than the bare minimum recommended amount that we'll cover. Marija is actually going to cover that a little bit more than I will. But that middle person is the same age as the third person. So you could see that there's quite a bit more fat, a lot more muscles wasted away, a lot more fat mixed in with the muscle. Same age, those last 2 people are the same-ish age, but there's quite a different life lived. And that signals to the body age more, and a lot more inflammatory processes go on. And you can do a lot to change how this goes for you. And that's what I wanted to promote is what's normal. Usually people come and find us at this stage in life and say, I can't do the things I want. I don't feel good when I go and do certain things like climb stairs, do housework. I just feel incapable. I can't get out of a chair very well. Well, you could put that work in, and you may need some help from people like us, but it's totally changeable. So cardiovascular risk or cardiovascular disease is the largest reason for death in the United States. Cancer is right behind it, but majority of it is cardiovascular. Our take on it in the clinic, where our role is to keep people moving, get clever about how to keep people moving. The pandemic was very clear about this. Everybody moved less. We did some other things too, like we ate more, we drank more, we saw people less, and those social things really do have a role in our overall health. But we saw it right away. We didn't stop working, but basically we saw everybody else stop doing their normal life things. Classes were canceled for them, their gyms closed, their walking group buddies didn't want to walk together, whatever. But all mortality increased in general. People exercised even less. Marija's going to talk a little bit about barriers to exercise, but the most common reason cited was lack of time. Well, the whole world was handed a whole lot of time all of a sudden, and we even exercised even less. So we are supposed to keep moving, and we can't take much time off that. And we're going to talk about that. I have kind of a weird comment at the bottom of the slide there that says humans and apes and dogs, they don't tend to move very much, or at least my dogs don't, and they don't seem to degrade a whole lot. But unique to us humans, it seems like we got to move more than a lot of other mammals to stay healthy. It's just kind of the way it is, and we'll get into a little bit of this. So I wanted to show you this gal. She was mad that she couldn't get out of a chair. So now she can, obviously. I don't know what weight's on there, but she's 74. I showed you the slide of the 3 different thigh muscles and what muscle looks like when you take a slice of you when you haven't been moving much. She was probably not making herself towards that master athlete look, but obviously she's quite a bit more functional, and she could take years off of her life for putting the fitness in, putting the work in. So that very first graph that I showed, where blood pressure tends to climb as we age in the United States, and as if that's normal. And I talked about whether or not loss of muscle as you age, how normal is that? Well, if you take blood pressures of tribesmen in Africa and South America, basically places that are untouched by our Western diet and Western stresses, age 15 to 83 years old, they don't seem to change in blood pressure. They actually don't seem to change much in grip strength either. Like when we do in our clinic, we have a little grip squeeze meter, and you can see how strong you are. And even on that has like a graph that shows decline with age and what's normal. It's not normal for these groups. They're always moving. They have lots of reasons to move, and they don't exercise. None of them go running. You don't ever see anybody going out and lifting weights, but they lift and carry water, do a lot of childcare, tending to fields. And it seems like our genetics are meant for this. We have to do a fair amount of it and often. And then nothing should change, or at least a lot shouldn't change. But so when somebody goes through a life with stable blood pressure, that end of life mortality, morbidity changes a lot. And this kind of studies have been reproduced with other kinds of populations around the world. So exercise by the numbers, we don't do enough of it. We're going to talk about what's the minimum amount, but it's pretty low as far as United States statistics goes. Most people just aren't getting it. On this slide, it says 80% of adults. Kids, adolescents, we're mostly not getting enough movement. Less than 5% of average adults engage in 30 minutes a day. And we'll talk about how much you should be doing. And Marija is going to get into more of like steps per day, but walking does get to count as a way of getting fitness. So, when I talked about what does it work for that person that comes in, if it's orthopedic concerns that physical therapy can help with, if it's something else that we can help you troubleshoot what the difficulty is with getting into a walking program, you may be able to benefit from somebody to talk about what's the fear, what's the holdup, what's the reason that you're not doing it. But this can be a really good way of keeping your heart healthy. So probably the single greatest modifiable health factor that we can be doing is the sedentary portion. And it is clearly more risky to your overall cardiovascular risk than smoking is. Just not moving is worse than smoking. I think it's probably the easiest thing to say, stop smoking, and I don't think that's ever worked for anybody to say, oh, you should stop smoking. And they go, oh, okay, I should. Yeah, you're right. That's good advice. But reality is you can make a larger difference in someone when you get them moving. Does housework count as fitness? It seems like no, because the hardest part is everybody varies a lot in what they perceive to be difficult. They can be very vigorous and totally contribute to your overall health and well-being and a healthier heart. But there's a lot of variability in what people perceive to be difficult. And Marija is actually going to get into what difficult stands for and how you would kind of judge what activity is difficult and how that can contribute to improvements in your heart health. But yes, there is some vigorous chores out there that totally contribute to your heart health. So my dad is one of them. He's retired. He's probably been retired for 15 years. He doesn't intentionally exercise ever at all. And he mows the lawn and he shovels snow. He lives in a place where he has to do both. And he will only do part of the job. So he will only shovel just enough snow out of the driveway to park his truck, or he'll only mow 1/3 of the lawn and save the other 2/3 for another day and always have 1/3 to be able to mow. So he doesn't exercise at all. He just walks to mow the lawn and shovel the driveway. But then he's always leaving himself something to do. And it's totally measurable because some times of the year he doesn't have either to do. He doesn't have either snow or grass, right? And he's got diabetes and high blood pressure. And when he's consistent with either one of those chores, he gets off both of his medications for both of those problems. It's totally improves enough that he's not taking his blood pressure medication. And I think metformin is the other one that he's taking. But when he doesn't have enough to do, he doesn't move enough. But so his housework clearly pays off for him in a heart health sense. But he's not consistent either. His year kind of does this where he gets more to do and less to do. And he does probably need to invest in a walking program. And no matter what I tell him, I'm his son, so he's not listening. So however you can get a clever way of stressing your heart, this isn't a good way. This is just a funny slide I found about cardiac stress testing on what they would do to stress your heart to find out how healthy it is. But, if you do find clever ways of stressing your system enough to promote fitness in you, we talked about housework. That's what my dad does. And he finds just different clever ways of finding stuff to do around the house so that he can get his fitness. Extreme example of that master athlete. This gal is actually here in Tucson. This article ran a few years ago. It was in one of our local papers. She's in her 70s at the time of this article ran, and she's got a lumbar fusion, and she doesn't have any pain, but she does these Spartan races. Some of them are 13 miles long, and they involve obstacle courses. She's carrying a sandbag in this, climbing over things, climbing ropes, going under barbed wire. I think they even shock you at times. It's kind of extreme, but they, this is just one of those master athletes. And, Marija is going to talk about like the low end. What's the minimum amount of fitness you should try to achieve in minutes or time or vigorousness? But there's more to benefit depending on what you want to do. There isn't really an upper limit. Exercise more, it pays off more. The return might be less, but it does pay off more. So here's a study for you. They had a bunch of college students get paid to lay around for 3 weeks. They're not injured or sick or anything. They just didn't do anything for 3 weeks. I think they stayed in the dorm room on a break. But what they found is that that 3 weeks off did a whole lot to their health. Like it really did a terrible amount for promoting inflammation in their body. They found these same people 30 years later, and they'd gained a fair amount of weight. I think 30 pounds on average, and they hadn't been great about exercise. Some of them did, some of them didn't, but they were overall more healthy then after 30 years of aging than the 3 weeks did from taking time off, from sitting still too much. So they were comparing completely sedentary towards, just sort of living life and not being totally sedentary. And that amount of time off was really a big thing for increasing all of the health-related factors. So here's an example for you. I was on a 2-week vacation fairly recently, and I always give patients the same spiel. Make sure you do your homework. I'm going to know it when you don't. And, some of them I could guess right away that, it was right around the holidays, and I knew that they were going to get busy and not do it. And so, basically I could see some of them regress pretty terribly. If there was some of them that did 15 reps of something fairly easy, 1 and 2 weeks later, they couldn't do it at all. That's how fast things changed for them. So here's another study for you. They took a bunch of high-level athletes that ran an average of 100 miles per week and paid them not to move. And in 14 to 21 days, they lost half the red blood cells. So red blood cells is the oxygen carrying molecule in your system. You need that more of those for higher cardiovascular fitness. Only took 2 weeks for them to lose half their fitness. So I did the same thing. I'm on vacation. I didn't do my normal weightlifting and running and things. And I know this. I didn't want to follow that the Dallas bed rest study that showed when you're that sedentary for that long, that it'd have that much trouble getting back into things. Another study where they had observed train conductors and or bus drivers. So when movement really matters, they found that just sitting in the seat for the bus driver or the train conductors that never got up and took people's tickets had a huge amount of increased cardiac events compared to those that just got up, greeted people coming onto the bus and or taking tickets from people. So they changed the policy so that some of them had to move sometimes, and they traded positions so that they would always have some movement sometimes, and they greatly reduced their cardiovascular events. So movement counts for a lot. You got to stay consistent. Fat but fit. So there's some myth out there about this. Sort of, maybe not. I would say mostly not true. So it seems like it doesn't pay off to stay moving and also keep some level of overweight or obesity to you. So here's an interesting one. So a couple of PhD students did this Pacific Crest Trail that goes from Mexico to Canada. They measured a lot of fitness-related items about themselves, blood flow, inflammatory mediators, all kinds of stuff. Right before, and they found out they're very, very healthy. But they did their quest to do this Pacific Crest Trail. So 12-ish hours of hiking every day for 112 days to get from Mexico to Canada. And their diets were terrible. So they eat Slim Jims and Cliff Bars. And then when they get to a town, they eat pizza and hamburgers. And they found out overall their health was worse after hiking this much. So you can't out exercise a bad diet. And we're talking about heart health for this month. Our special role in this is keeping people moving and why that matters. But there's definitely some boxes to check. You know, you can't do these things in isolation. So you can't out exercise. Well, this is particularly a really bad diet, but and this kind of goes on to say the same thing on this slide. So they did the best they could, but they couldn't out exercise all the pizza and hamburgers. So there is kind of this culture problem, as you would have it, as it relates to exercise. You know, I spend all day in the clinic kind of debunking myths when it comes to the bad information. You know, I'm supposed to lose muscle when I age. I'm not supposed to be as capable as time goes on. It's pretty debatable. You know, it doesn't seem to be too normal when you look at other populations that that's part of the deal. So, you know, what you do need to talk about with your providers is what you're dealing with, particularly how safe it is to exercise, what you can be doing. Marija is going to go into a little bit about that. But what I didn't want to do either is talk about fear-based motivation. You know, exercise or you're going to have an event. You know, it doesn't really seem to work. There's clever ways to get people moving and get you motivated. We are wired as a species to do things together and enjoy it. And that's what we promote. Do something you enjoy. My wife drives all the way to Ina a couple of days a week to work out with her friends because that's how she gets it done. That's how she pushes weights around. When we have about every piece of equipment at the house she could have, she just won't do it there. She has better compliance when she goes and meets her friends. So there's a lot to that. So I said, as far as the bare minimum goes, the CDC is recommending 150 minutes per week. And that does correlate to a 40% reduced risk for all common reasons for mortality. I had that original graph that showed master athletes compared to the normal population. It does take several more hours per week to get to the next decent chunk of benefits. So another 30% on top of that 40% of reducing your risk for mortality. So there's a bare minimum, and Marija is actually going to talk about steps and other things that do a good job of what you can do to catch that bare minimum. But you do get more the more you do. The payoff just gets less as time goes on. But those master athletes, you can see, is a clear payoff. So it doesn't seem to be an upper limit, though. Like, could you exercise too much and then lower your cardiovascular health? And it doesn't seem to be. The science hasn't said so yet. So high intensity interval training is when I go and do something very vigorous and then take a decent break and then go do something very vigorous. And then if you compare that to doing something moderate, like go for a walk and kind of keep your brisk pace, when it comes to cardiovascular health or your overall mortality, it doesn't seem intensity matters a terrible amount for at least your cardiovascular health, but intensity matters for a lot of other things like just functional ability, depression, anxiety. There's quite a few other things that you could help yourself with, chronic pain factors, that vigorousness, fit into life somewhere, seems to have some great benefit. So if you can fit it in, that actually will pay off better for some other things. But if it's not for you, and I said, do what you enjoy, then you can get the same benefits from being moderate. So this was my time here. I'm going to pass you off to Marija, and she's going to get into the more nerd content. So thank you.
All right. Thanks so much, Jake. So Jake already talked about what are some consequences of reducing physical activity through the bed rest studies. But I've got a couple more studies that are really interesting. So a more recent study took highly active volunteers, people who were getting more than 10,000 steps a day, and had them reduced to less than 5,000 over just a 5-day period. And their findings were decreased artery flow mediated dilation, endothelial cell activation, and these cascades and all the things that are going on a molecular level are really complex, but basically what that amounts to is as these processes continue, your blood pressure will increase, your blood vessels and your left ventricle will stiffen. And then in another smaller study, healthy older adults, I believe the age range was 65 to 82. They took these people and had them on bed rest for 10 days. And that 10 days was equivalent to a decade of decline in aerobic capacity. But I want to emphasize that aerobic capacity is the first thing to go when you stop being active, but it's also the first thing to start to come back when you start being active again. So that is changeable, but just a very stark example of how quickly it can happen, like Jake was saying. So when you stop being active, cardiac remodeling occurs. So this is really interesting. In athletes and master athletes, you will see that the left ventricle, which is the chamber of the heart that's responsible for actually doing the pumping action and getting that oxygenated blood to your peripheral system, so it gets to the muscles and to your brain and all the tissues, the muscle wall will actually thicken, and that makes it more effective and efficient. But people who have chronic hypertension will also get thickening of the left ventricular wall. It's called left ventricular hypertrophy. The difference here is that people with hypertension have a pathologic version of this. So that muscle actually becomes less compliant, becomes harder, and that makes it more difficult for the muscle to pump efficiently. But exercise can improve or even prevent left ventricular hypertrophy and get you more to the point that it's looking more like how an athlete's heart works. So CDC and ACSM guidelines, CDC, Centers for Disease Control, ACSM, the American College of Sports Medicine, recommend 150 minutes of moderate intensity aerobic activity per week and at least 2 days a week of muscle strengthening. And also you could do 75 minutes of vigorous intensity exercise. So that leads to a lot of questions, like what kind of activity is best? What counts as moderate intensity? How often should you be exercising? Is it okay to just go for a weekend warrior approach, or is it better to get a little bit every day? And then you might be wondering, well, what if right now I'm not in shape and I can't do 30 minutes continuously or even 10 minutes continuously? Well, let's talk about that. So can just anyone start an exercise program? In 2015, the ACSM, American College of Sports Medicine, updated their guidelines. So the question to ask yourself is, do you already exercise regularly? If the answer is yes, and you have managed cardiovascular, metabolic, or renal disease, meaning that your doctors know about it, it's well under control, keep exercising, right? And if you already exercise, but it's not under control, or you want to increase the intensity of your exercise, go ahead and get medical clearance. If you don't already exercise and have those issues, get medical clearance. Pretty much for everyone else, starting a physical activity program is beneficial. It's also beneficial for people with these diagnoses, but there are some special considerations to make sure that you're being safe. So one of them is my blood pressure too high for exercise? Well, 46% of Americans actually have hypertension according to the new blood pressure categories. So now elevated is considered anything above 120 for systolic and anything above 80 for the diastolic. So most likely your blood pressure isn't too high, but some caveats. I'll tell you right now, as clinicians, if your blood pressure is above 180 for the systolic or above 105 for the diastolic, we're not going to have you exercise that day. Okay. The ACSM does have some different recommendations. That number is on that slide here. If you're at 180 or above, or definitely diastolic of 120 or above, you really should seek your doctor immediately and get that taken care of. But for everyone else, if you are slightly hypertensive, exercise actually does help. And are there risks to starting an exercise program? Well, as far as cardiovascular health, your physician may put you on physical activity restrictions following an event or a surgery. And at that point, you may go to cardiac rehab, like Jake talked about. But if you start experiencing any angina, so chest pain, nausea, extreme shortness of breath that's out of proportion to the activity, or extreme sweating when you're being active, please stop, because those can be signs that something isn't quite right with your cardiovascular health. Orthopedic considerations are mostly what we see as physical therapists and tend to be the major barriers to starting physical activity. So if you have orthopedic pains or a history of falls or any concerns about your balance that are preventing you from becoming more active, please come and see us. We can work with you to not only address those specific pains, but get you into a safe exercise program so that you can start to increase your physical activity. And then DOMS, delayed onset muscle soreness. I'm sure many of you have had the experience of starting to work out after you hadn't been active for a while and then becoming very sore either that night or the following day. That is normal, but for some people, if you haven't been active for a while, it can be a little bit scary. Your entire body feels really sore, and it can be a barrier. So again, seeing a PT is a good way to kind of make sure that you're getting the right amount, but just do know that a little bit of soreness is normal. It should go away, by the way. I'll just go back to the slide. It should go away within about 24 hours. If you're very sore for 2 days, you probably did too much. Okay, so what even is moderate versus vigorous intensity exercise? The American Heart Association defines moderate intensity exercise as the list on the left, vigorous intensity as the list on the right. An easy way to see if you are exercising at one level versus another is the talk test. So if you were to be exercising with a friend, if you're working at a moderate intensity level, you should be able to keep a steady conversation, maybe need to catch a few breaths here and there, versus vigorous activity. You're not going to be able to speak in full sentences. You're probably huffing out a few words at a time, right? And in PT, we'll use something called a rate of perceived exertion scale. There are a couple of different types of scales. This one goes from 1 to 10. There's another one that goes from 6 to 20. In this case, on the 1 to 10 scale, moderate intensity, you might be working at an upper range of a 3, a 4, or 5. Vigorous, you're starting to get into 6, 7, 8 territory or above. How often should you be exercising? Well, we know, and it's been demonstrated again and again, that exercise reduces blood pressure, both immediately afterward and in the long term when it's done consistently. So daily exercise is best. 20 to 30 minutes a day is the ideal. But if you're not there yet, work your way up. Don't let perfect be the enemy of good, right? Everyone's got to start somewhere, so you want to work your way up. So this is an interesting study that was released last year or the year before that looked at physical activity patterns in older adults from their 70s up to their mid to late 80s. And they looked at people who stayed stable. So if they were active and stayed active, were inactive and stayed inactive, and then people who increased or decreased their activity levels, right? So what they found was older adults who were previously inactive but increased their activity to 20 to 40 minutes per day had the largest reduction in heart disease and heart failure in older age. So starting in their 70s, it wasn't too late, right? 20 to 40 minutes, they were able to have these massive impacts on their heart health 10 to 15 years later. But the people who did the best were those who stayed active. They had a 52% lower risk of cardiovascular disease overall. Takeaway there is staying active or increasing your activity reduces heart disease even in your 70s. How much exercise should you be getting to impact hypertension? This is an older study, and it did exclude people who had a cardiovascular disease diagnosis. However, the findings were that even 30 to 60 minutes per week had a positive impact on blood pressure. So you can see on the chart on the right, I've highlighted around the areas where there was a reduction in blood pressure. So you can see that there were significant differences in pretty much everyone, but the greatest impact, the most statistically significant, was at 61 to 90 minutes per week. And there's a little bit more gain the more that you did. And that's like Jake mentioned, right? There's a sweet spot. You get fewer returns the more that you do, but there are still a lot of benefits to doing more than the bare minimum. Some is always better than none when it comes to physical activity. So studies are showing that even 10 minutes of moderate to vigorous intensity activity per day decrease the amount of deaths per year in the US. 3 to 10 minute bouts of exercise that are interspersed throughout the day show similar blood pressure reductions as continuous exercise. So even if you're strapped for time, if you hear a song come on that you really like, dance to it for those 3 to 5 minutes. Get your heart rate up, because even that can make a huge impact. A lot of people walk as their primary form of exercise. And you may be wondering, well, is that enough? Is that good? Should I keep walking? And the answer is yes, you should definitely keep walking. But a recent interesting study, excuse me, found that taking equal to or greater than 7,000 steps per day was associated with a 50 to 70% lower risk of mortality. Okay. And there was a women's health study that looked at women with the mean age of 72, and they showed that there was a leveling off at 7,500 steps. So anything above that, again, a little less return on that investment, but still beneficial. But even improving from 2,700 steps per day to 4,400 had a clinically significant impact. 7,500 just happened to be best. So what happens to your heart when you increase activity? During activity, your heart rate, respiratory rate, and blood pressure will increase. But there's decreased blood pressure immediately following exercise, and that's true for all fitness levels, whether you're taking hypertension medications or not, and whether you're male or female. You also see decreased blood pressure in the long term, and again, cardiac remodeling, which we talked about earlier. So post-exercise hypotension is what we term the drop in blood pressure following exercise, and it can last up to 22 to 24 hours after exercising, and that's why we say daily exercise is best, right? Because if you can have that blood pressure drop and then you exercise again the following day, you're staying at a steady state of a lower blood pressure as opposed to waiting and your blood pressure rising again and dropping. So this study looked at the most ideal forms of exercise. So they looked at what type of exercise had the greatest impact: jogging versus resistance training, walking, cycling. Jogging had the biggest impact. And then as far as intensity, increasing intensity had the biggest impact. But the cool thing about this is that all forms of exercise and all intensity levels had significant impacts on blood pressure. It just happened to be that jogging and increasing intensity had the most. How much of a difference did it make? Well, regular aerobic exercise reduces resting systolic blood pressure by 5 to 7 points, millimeters of mercury. Resistance training, 2 to 3 millimeters of mercury, but studies are showing that dynamic resistance training, so incorporating a little bit more movement, can have effects similar to aerobic exercise. So Another recent study in 2021 looked at 53 adults who had treatment-resistant hypertension, so they weren't responding to medications, and they had them follow a specific protocol for exercise. Interestingly, they just did 3 moderate intensity 40-minute long sessions per week. We already know that daily is best, but even they showed a decrease in their blood pressure. So, takeaways that we want you guys to get from this: movement is medicine. And if you don't already exercise, start small because it will make a difference. Exercise comes in many forms. You should do what you enjoy doing. And then talk to your doctor about starting an exercise program if you have cardiovascular, renal, or endocrine disease or metabolic disease. And please see previous lectures for more information. Again, there have been a lot of great lectures, and they've covered a lot of information. So that's all I've got for you. We've got lots of references. If you're curious about any of these particular studies, you can read through them.
Thank you so much, Marija. I do have a couple of questions that came up. Well, I do want to mention that on the bananas, somebody said that last banana was for banana bread. So
yeah,
that's true.
Why does it take so much longer to maybe gain your fitness strength compared to how quickly you sort of decompensate for it? Any ideas on that? That's one of the questions. Why does it seem to take that much longer to sort of get up to speed as compared to how quickly you can decondition based on your studies?
I think that this could be put down to how adaptive our bodies are. So our bodies don't want to put in more energy and work into something that they're not going to be doing. So there's no reason for your body to spend extra energy maintaining your fitness level if you're not using it, right? That's extra calories that are being used. So we adapt very quickly. So that's a major reason why it goes so quickly. I don't know if you have anything to add.
And is there any kind of a recommendation on, I know minimum steps, we always hear 10,000 steps, right? But does that change over time, and do the minutes of movement change as you age as well?
So no, the 10,000 steps is kind of like an old myth, I would say. That number got thrown around quite a while for a different study that came out a long time ago. But it seems like the 7,000, even as low as 3,500, were more correlated with less mortality or bigger payoff for the amount that you're putting in. So, no, but that advice as you age the recommendation amount that doesn't change. So,
okay,
you should be getting the same amount of steps per day, pretty much regardless of age.
And would the minutes of movement change at all, or would that stay the same as well?
Yeah, it stays the same.
Okay.
We feel 150 minutes per week is the low end, and the more you do, the more you get.
Right. Okay, great. Now, if somebody wants to come would like to see you for any kind of PT needs, can you maybe explain what that process is like? What do they need to do? We might as well, I'd like to, you guys do great work over there at Outpatient Therapies. So can you just share, they need a referral, correct?
Yeah, they do need a referral. So their primary care or whoever's sending them, just send the referral over to the outpatient therapy. And that's it. They talk to the front office about cost of being there or insurance. And when they call, they'll let them know if, their insurance is taken and what the process is from there. So just have them send it over. The outpatient is across the street, south of Grant.
Okay.
And there is also a self-pay option for people who don't want to use their insurance for whatever reason.
And you really cover a lot of different types of therapy, I know, over there. So anything, if somebody is interested, they should definitely reach out because I know that we've got you have so many different specialties over at Outpatient Therapies. So It's really a great place. You guys have a really nice new space. We had done a fall prevention series over there, and it was wonderful just for everyone to be able to see what types of things you offer. So I want to thank you so much for being here today, and we look forward to having you again in the future. So we'll sign off for now, and we'll start to see everyone. Our new calendar just came out, so please be sure that you check out all the new offerings. We'll be doing quite a bit on brain health in March and April. So we look forward to seeing everyone then. Thank you.
Thank you.